What's up, guys? How's it going? Cade Moore with More Muscle. Today we'll be talking about 10 mental health questions and a little practice test to increase your mental health knowledge. So the first one is, a client has schizophrenia. What should the healthcare team expect? And the answer is a speech that reveals thought patterns that shift rapidly from one topic to another. So guys, if someone has schizophrenia, you're gonna expect a different thought pattern. You're gonna expect, you can see hallucinations. The next one is, the client has bulimia nervosa. What should you expect? Eating large amounts of food at one time, uncontrollable appetite. Guys, bulimia nervosa is when you eat a lot during small periods of time, and you wanna basically do excessive exercise, or take, or make yourself throw up, or take like Miralax to make it just all go out, right? So yeah, it's bulimia nervosa. What can help someone with Alzheimer's? You want to reorientate the patient with daily activities. You want to encourage reminiscence of old memories, and you want to present one option at a time. So guys, someone with Alzheimer's disease, they're going to be forgetting things. So you want to reorient, the patient with daily activities. You want to encourage reminiscing of old memories, and you want to be present one option at a time. The reason that is because you don't want to give them too much options, and you don't want to overwhelm them. So that's that. So a client has moderate stress anxiety level. What should you expect? The client has difficulty concentrating is the answer. Heightened perceptual field. And as anxiety increases, heightened field becomes narrowed. Somatic complaints increase. So guys, somatic is something, it's kind of hard to explain somatic, but it's basically something that's not real, right? So for example, somatic pains are like someone thinking they're really sick, but they're actually not, or they have excessive worries about, health. And so somatic pain is from anxiety. That can be from anxiety because there's not actually anything wrong with them, but their body and their mind thinks there's something wrong with them, and that increases their shortness of breath, the racing heart, and an impending feeling of doom. So that's anxiety. That's what you should expect with someone with moderate anxiety. And this is the thing that I like the most. As anxiety increases, heightened field becomes narrowed. So as anxiety increases, you're gonna be able to focus less. So someone that's super anxious isn't gonna be able to focus. They're not gonna be able to understand things. And that's when you wanna use a very, strong, authoritative voice and tell them, what they need or whatever it is. Okay guys, the next one is, a client with schizophrenia is hearing voices. What should you do? The first thing is, you should ask them what the voices are saying. Command hallucinations that they occur when someone has schizophrenia. We want to see what those voices are saying, because if there's a chance that those command hallucinations are saying, hey, I want you to harm this person, or I want you to do this illegal thing, or I want you to do self-harm, we need to know about that as, a healthcare professional. So that's the most important thing. If someone's hearing voices, you want to know what they're saying. So you got to ask them directly, what are those voices saying? And you want to follow up and see if this patient's at increased self-harm risk, or if they're planning on, harming someone else. Now, not all, auditory hallucinations are bad, but some of them are, and you want to double check. The next thing is, you can also encourage the patient to listen to music. That's going to help them, listen to music instead of the command hallucinations. So music can help with that. Okay, let's see. A client has Alzheimer's disease. What house modifications should be provided? So guys, this is a big one. Locks should be installed due to a flight risk, right? So when you have Alzheimer's, your memory decreases, and say if that person goes out their front door and they're gone and they take off, no one's gonna be able to find them. And remember, these guys, these Alzheimer's risk, they're increased risk for dehydration excessive hunger. So it's important for these people with Alzheimer's or dementia to have, it's kind of sad to say, but to be locked into a building, kind of like prison, but it's for their own safety. You don't want them to take off. You don't want them to, do something where they don't remember where they're at and they're lost and, people don't know where they're at. So the biggest thing is you want to install locks in the house if someone has Alzheimer's. Also, you want to decrease the risk for fall risk. So, removing things that can have them trip or whatnot, that's important. People with Alzheimer's and dementia can have an increased risk of falls. So you want to make sure that the place they're in is safe. Okay, guys, what is some antidepressant medication administration education for older adults? And guys, I like this because it's not just for antidepressant medication, but this applies to most medications for older adults. So as you age, your body gets older, you're not able to absorb things as well, and that increases the risk for adverse effects. If you are new to the healthcare field, what I would like you to do is go look up a medication and see what adverse effects it has. A lot of medications have adverse effects, and it's kind of scary because sometimes, me personally, it's my opinion, but some of those side effects are even worse than, it'd be better not to take the pill at all because of how bad those adverse effects are. But anyways, I don't want to get into that. That's my own opinion. That's not facts. But anyways, so what is some antidepressant medication administration education for older adults? Older adults require a lower initial dose. This is due to altered rates of absorption and increased risk for adverse effects. Older adults have decreased absorption, distribution, metabolism, resulting in delay in therapeutic effects. A full month of treatment may be required to achieve therapeutic effects. Older adults have increased risk of adverse effects due to the decreased rate of excretion. Okay, guys, so this is sad, but as we age, our bodies get weaker. It's important to, always stay healthy and do all that you can to keep your body healthy. But as you age, things get worse. For example, many times when the older adults I've seen, they get urinary tract infections, they get hallucinations, and they basically lose their consciousness, where they kind of just don't know what's happening. I've seen lots of older adults have UTIs and they're out of it for a couple of days because they're confused because of how much that UTI does to the body. But for example, if a younger person gets a UTI, it's usually gone in a couple days, no problems. So as you get older, your risk for just everything can increase, and it's gonna be harder to stay healthy. And especially if you're taking hard medications, that can be problematic for someone that has a liver or kidneys that can't filter as well as it used to. So you want to start with lower medication dosages, and you shouldn't expect therapeutic effects for a while, and longer than a normal adult. Okay, guys, now we're going to go to what is the common actions for antisocial disorder. So antisocial, you think of they don't want to be around people, but this isn't always true. And for antisocial disorder, they're unconcerned with rules and normal behavior. They use manipulation. They do harmful behaviors without remorse, aggression. They disrespect and they take advantage of people. They have impulsive behavior. They're hostile towards others. And they have a feeling of superiority to other people. So basically, with antisocial disorder, they don't care what people think. They're not doing the norm, and they'll try and manipulate and take advantage of you, and they feel like they're superior than everyone. So that's antisocial disorder. The next one is bipolar disorder. What should you expect? Bipolar disorders, guys, it can be extreme mood swings, mania, depression, extreme sadness, extreme happiness. It may affect the ability to think correctly. You can be manic, so you'll sleep less, more energy, excessive talking, racing thoughts, easy to distract, and poor decisions. Guys, similar with bipolar disorder, you want to protect them from not spending excessive money because they have these highs and lows. You know, they could go spend $3,000 in a week, and then the next week they'll be like, oh, I'm so depressed, because they have these extreme mood swings where they feel extremely happy some days and, you know, other days they don't. So you want to monitor them, and you want to make sure they're not committing any risky activity that could be harmful to them. Okay, guys, what's the next thing? What are some symptoms of panic disorder? One would be flushed, perspiring, so like sweating, palpitations, feelings of heart attack, and a feeling of doom. Guys, panic attacks aren't fun. It basically feels like you're having a heart attack, and for, you know, sometimes a minute or two, it's like the worst thing ever because you feel like you're gonna die. I've had a couple of panic attacks, and they're not fun at all. And I literally thought there was something wrong with me. I thought I was having a heart attack. I thought I had a clot in my, you know, arteries or something, but it turns out it was just a panic attack. Yeah, and that's basically, you know, you're gonna expect to see feelings of a heart attack, feeling of doom, sweating, anxious. That's a panic attack. Anyways, guys, thanks for watching.